Ossoff from Georgia is online from his office.
Thank you, Mr. Chairman, and thank you, Director Chopra, for your service and your testimony here today. Building on what Senator Cortez Masto was just discussing in terms of the impact that adverse credit reports can have on Americans, let's talk about how this can impact veterans and what you can do, Director Chopra, to protect veterans from improper billing and collections from providers of community care services referred by the VA. You published the Office of Service Member Affairs 2022 annual report. It noted that you receive many complaints from veterans who incur medical debt as a result of a community care healthcare provider that is a third-party provider to whom the veteran is referred by the VA for some outpatient services, who trust that those community care providers will bill the VA, but instead they bill the veteran improperly. Then it gets referred for collections. And then suddenly this veteran has collectors coming after them, maybe an adverse credit reporting event. The report that you issued, Director Chopra, recommended that medical providers and third-party billing companies should have adequate systems in place to serve veterans. Of course, they should. What else can you do with the powers at your disposal to protect veterans who are at risk of becoming trapped by medical debt, having adverse credit reports because of the failures of these healthcare providers to properly bill the VA?
Well, let me just say that credit reports should not be a tool to extort money out of someone who doesn't really owe it. And I think for many veterans and frankly many Americans, they end up just paying it because it's such a headache. We've already taken a few steps. One, we've put some focus on nursing home debt collection. This is a place where we want to make sure that debt collectors who are collecting on nursing home debt know that's when there might be indicia that those debts are invalid. This issue of outpatient referrals from the VA, we're really pleased to work with the VA on how they are dealing with credit reporting. They have updated some of their rules about when medical debts will be reported. It will drastically reduce the number that are reported, because ultimately, I think we don't want to penalize veterans for getting medical care for which the law entitles them to receive as benefits of their service. So, Senator Ossoff, I think there's other places in credit reporting and debt collection that we continue to find concrete solutions to address these issues.
I appreciate that, Director Chopra. Let's talk about new mothers and the costs of pregnancy and childbirth. The University of Michigan study published last year found 24% of pregnant and postpartum women report unmet health care needs due to cost. 1 in 5 parents receive an unexpected charge averaging $744 on their hospital bill following childbirth. That's on top of $4,500 in out-of-pocket spending on average that each woman spends on care from 12 months before to 3 months after delivery. We know, and we've been discussing the impact that medical debt can have on families. We're talking about families with new children. How do you address the impact that this can have on pregnant women and new mothers, and what more can you do to protect them?
I think that there is big concerns about how big medical events can often trigger personal bankruptcy. It's a financial distress is often an underpinning is often financial issue, often medical issues. And I think the last thing we would want is to see that, pregnancy and new mothers having to deal with mistaken credit reporting, surprise billing. Of course, the CFPB's role is really on credit reporting, debt collection. But of course, and we're happy to brief you further on the work with the Department of Health and Human Services, the work we do with others to address this really complex and convoluted system of medical billing and how it is becoming the #1 collection item over time on individuals' credit reports.
Dr. Chopra, thank you. And I think that these issues faced by veterans and new mothers speak to the essential role that the agency plays in protecting consumers. My final question It's about service members who, for example, are undergoing security clearance investigations. Your Office of Service Member Affairs report found that in 2021, credit reporting companies were, quote, not responsive to service members' requests for investigations, jeopardizing their security clearances, job security, and promotion eligibility. They're not getting timely responses from these credit reporting companies when, for our military service members, their jobs and clearances on the line. What more can your agency do to ensure that credit reporting companies respond in an efficient and effective manner to these service members' requests and when service members bring complaints to you?
Well, we've certainly seen a bit of an uptick in their responsiveness, but ultimately we're going to have to assess them for legal compliance too. They have requirements to assure maximum possible accuracy using reasonable procedures. And I think that's a place where we're very, very focused on whether they're meeting their legal obligations on dispute and accuracy. So, of course, their compliance with the law has huge ripple effects on all segments of the population across the country. And so we'll continue to do work when it comes to the Fair Credit Reporting Act, including exploring potential rules.
Thank you. And Mr. Chairman, I know my time's up. I'll just say this, Director Chopra, the Congress authorized your agency to undertake these activities explicitly in statute, precisely so that you could protect consumers such as we've discussed today. Thank you for your testimony.